Hello everyone. Today we are going to discuss the disorders of endocrine system. The first hormone is growth hormone. It's produced from the pars the cells of anterior pituitary, also known as adenohypophysis. If there is oversecretion of growth hormone, it results in abnormal growth of body known as gigantism. And if there is less secretion of GH, it results in stunted growth, which is the condition is known as pituitary dwarfism. If there is excess secretion of GH in adults, especially during middle age, it results in severe disfigurement, especially of face, and the condition is known as acromegaly. It has serious complications and it can lead to death of the person. And it's also hard to diagnose during early years until the facial abnormalities become evident. Here is the person is suffering from gigantism. This one is suffering from pituitary dwarfism, and this is the case of acromegaly. Severe facial disfigurement you can notice here. The second hormone is antidiuretic hormone, also known as vasopressin or pitressin. It's produced by the hypothalamus and it's stored and released from the pars nervosa, also known as posterior pituitary. The function of antidiuretic hormone is the reabsorption of water and electrolytes from the distal tubules of nephrons. Thereby it prevents dry uresis, that is loss of water through urine. If there is deficiency of ADH, either due to decreased synthesis or decreased release, water conservation ability of nephrons decreases and there is water loss in dehydration, and this condition is known as diabetes insipidus. Third, we have thyroid hormones. Deficiency of iodine in diet leads to hypothyroidism and there is enlargement of thyroid gland known as goiter. Here in the figure you can see the enlargement of thyroid gland known as goiter. If there is hypothyroidism during pregnancy, defective development and maturation of growing baby occurs. The growing baby is stunted. That means this condition is known as cretinism. Has low IQ, it's mentally retarded, abnormal skin, and suffers from deaf mutism. If there is hypothyroidism in adult women, it results in irregular menstrual cycle. Cancer of thyroid gland and thyroid nodules. Rate of synthesis of secretion of thyroid glands. Thyroid hormones from the thyroid gland increases and this leads to hyperthyroidism. Exophthalmic goiter, also known as Graves' disease, it's a form of hyperthyroidism. The characteristic features being protrusion of eyeballs, which is known as exophthalmos, and enlargement of thyroid gland, that is goiter, hence the name exophthalmic goiter. There is elevated basal metabolic rate as it is a case of hyperthyroidism, and due to elevated BMR, weight loss is seen. If there is underproduction of hormones by the adrenal cortex, especially the glucocorticoids, carbohydrate metabolism is altered, which results in acute weakness and fatigue. This disorder is known as Addison's disease. Last, we have diabetes mellitus. It's basically a case of prolonged hyperglycemia, glucosuria, that is loss of glucose in urine, ketonuria, loss of ketone bodies in urine, and formation of ketone bodies is seen in diabetes mellitus.